You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have an expert on the topic, periodontist, Dr. John Thousand. Dr. Thousand, welcome to the program.
Thanks for having me on here, Randy.
Good. Now, you brought a lot of photos. I mean, dramatic photos. So we're going to get to as many of those as possible.
And I am pumped to talk to you about
Okay,
these.
good. Now, for people that don't know your practice, I mean, like, who's the typical implant patient these days?
We've got two different types of patients, generally. I mean, we could get more specific than that. But we got two different types of patients coming in. We've got patients that have dental diseases, cavities, bleeding gums, periodontal disease. And these people, you know, whether they're in pain or they're not in pain and they don't know they've got a problem, they'll be transitioning into implants. So a lot of these patients don't even know they have problems because they haven't been to the dentist in a long time.
Okay.
And they think that their only option...
You say like 10 years.
Could be longer than that. I routinely see patients that haven't seen a dentist in 10, 20, sometimes even 30 years.
Okay.
So they have no idea that they have all these problems, and they think that their only option is to just go straight to a denture. But that's not always the case. So there are other ways of solving these problems without going traditionally.
Because you don't like dentures.
I hate dentures.
Okay.
Two pieces of plastic flopping around in the mouth. Now there are some prosthodontists that are very good, and general dentists, that are very good at making these dentures.
Okay.
Well, but it's nowhere near what it could be.
Okay.
I mean, you could talk about the functionality of a denture. For example, if you were to take from 0 to 100%, 0 being no teeth, 100% being natural dentition, all of your teeth, all 28, minus the wisdom teeth.
Okay.
Then a denture would lie somewhere around 30% maximum function. If
you just can't chew things.
Right, they're terribly ineffective.
Okay.
You're essentially a cow, just
kind of rubbing things together.
Yeah, pretty much.
Okay.
Right? But if you add implants, you can get that number much closer to the natural dentition. Remember, that's at 100%. You can get it anywhere between 70 and 80% of what you originally had, maybe even better than that, depending on how well it's designed, how many implants are placed.
Okay.
Yeah. Okay, so we were talking about the different types of patients that come in. So the first is patients with teeth, and they think their only option is a denture.
Okay.
The second set of patients is patients that have no teeth already. So these
They're
are
wearing a denture.
They're wearing a denture, and they've been in this denture for forever. So they haven't been to the dentist in forever also because, once you transition from teeth to the denture, you stop going to the dentist. There's really no need at this point, even though we all think that you should.
Okay.
Just in case something else pops up, we should probably catch on to that.
Yeah.
So these patients that are wearing dentures come to us either by referral from their general dentist or because they heard about us through their friends or family that are looking for a brand new set of upper and lower teeth that just don't come out.
So are there a lot of people in Florida that have dentures? I mean, is this like a big problem there?
You know what? I would venture to say that it's probably one of the highest locations for denture wearers in the United States. We have a large retirement population there. I think, in fact, actually, Randy, you could probably fit 10 football fields of people that wear dentures just from Florida.
So if there's so many people, tens of thousands probably within like an hour of your practice that have an upper lower denture, that why aren't they all doing it? Why aren't they all coming in to get their new teeth?
Randy, that's a good question.
Okay.
I think that a lot of it has to do with the fact that they've been in dentures a long time. They don't go to the dentist.
Okay, good
Once
point.
you get a dentist, you really don't have to go. Once you get your dentures, you don't really have to go back to the dentist. So you're not checking in. You don't know what's going on as far as...
You don't know your options.
Right, and there's a lot of stuff that probably changed since the last time you were in to see a dentist.
Okay.
That brings me to my second point here, where these patients also too, they probably had a pretty bad experience leading up to it, right? It's just cavity after deep pocket and gum disease, and they eventually got to the point where they couldn't fix this stuff anymore, and somebody said, you got to take these teeth out. And then bam, now you're in a plastic set of dentures, and you think that that's the best thing that could happen to you.
So the last thing they want to do is come see you.
Oh yeah, they've had terrible experiences with dentists. But that's so common for us. We're so used to that being, sorry, Dr. Thousand, no offense to you, but I really don't want to be here today. I totally get it. I get it. You've been through a lot of dentistry trying to rebuild your mouth, and then it all failed. Now you're in dentures, and you're frustrated. I get it.
Okay. Now what about people though? And you're a periodontist, so you know about the gums. What about people with bleeding gums or the gum disease? Can they do this, or their gums are too bad to get dental implants?
Oh, absolutely. They're wonderful candidates for dental implants. We have to be careful with their maintenance afterwards to make sure that we maintain what we've placed inside their mouth. But absolutely. No, periodontal disease, cavities, both makes no difference. We can definitely transition you to an implant-supported new set of teeth.
Okay, good. How old can you be to get this done?
There is no age limit. I know a lot of people think I'm older, I don't heal as well. That's entirely false. Now, there are some components of healing that slow down, but it has absolutely no effect on the long-term success rates of full arch implant
Like
dentistry.
how old? I mean, 80s okay, you can do this?
Yeah, absolutely. I've had patients in their 90s do this with me.
Really?
Yes.
Why would a 90-year-old want to do this?
90-year-olds eat and chew as well. I
Okay.
mean, they're just excited about, actually, they're probably more excited than you or I would be to go out in public because, or to eat out in public because that's one of the most fun things they do. You know, it's actually really cool. When you look at Florida, people come down here and, you know, they're retired. So they're no longer focused on their career, and maybe some of them are still, you know, dabbling. A lot of patients.
We're
still
talking about
are.
80s. People
Oh
their
yeah, 80s.
Okay.
Absolutely.
That's young today.
But they go out and they have a good time. And when you're going out and having a good time with your friends, you want a solid set of teeth that don't come in and out. Let's say you get a knee slapper, right? And
What does that mean, knee slapper?
A hilarious joke.
Funny joke. Okay.
Somebody's got something they say to you and it's absolutely hilarious. You want to be able to kick back and not worry about your teeth falling out when you laugh.
Did they worry about that?
Absolutely.
Interesting.
Yeah. Randy, I'm actually super excited today because I brought you some photos.
All right.
And this is some of the stuff that we can do. From taking patients from where they were to where they are now, I'm very excited about some of this stuff.
Okay, good. Let's take a look.
This is a photograph of our first patient. And take a look at that guy.
All right.
This is Francis. So Francis was referred to us from his general dentist, and he had basically two options: dentures or implants. And there was no way this guy was going to get dentures because remember, one of Francis's favorite things to do is eat. The other thing too, we got to remember too, is Francis is a minister.
Okay.
And he also does this Santa Claus gig that he's super pumped about. And both of those involve speaking in public, and oftentimes too, he's up close and personal with kids and family. So, you know, he had to be careful with, you know, his breath, definitely the appearance of his teeth. Even with the Santa Claus beard, you can still see what's going on in there. You know? So Francis, like I said before, cannot do dentures. There's no way he's going to chew the way that he wants with dentures.
That's why it goes to you.
Yes.
Okay.
So he came to us seeking implant options. So we took him start to finish from no teeth in 1 day, 2 teeth. And Francis couldn't be happier.
Is that right? Now he can eat whatever he wants.
He eats whatever he wants. Yeah, actually, one of the coolest things you can do is ask a patient just how awesome it is after we give him the teeth. And, you know, that's one of the first things Francis decides to do is go out, have an incredible meal, and not have to worry about anything. He can chew, he can rip into a steak with these new teeth. With his new teeth, he has no trouble at all. He comes into our office. Actually, he came in one time wearing a Santa suit. Gave us all candy, which you should never do. Never give a dental clinic candy. Yeah. But yeah, hilarious guy. This has changed his life for the better.
So in 1 day?
In 1 day.
And now he can eat whatever he wants.
Whatever.
And how long do they last? I mean, if everything works out, I mean, they're like permanent teeth. You could.
Yeah. That's the cool thing about implants. As long as they're well maintained and they're placed correctly and everything's done correctly, you absolutely should be able to keep these things the rest of your life. All right, so you want to talk about another one?
Let's take a look.
I got case after case.
Okay.
All right, so this is Kevin.
You like this? It's like you're showing me baby pictures here. You're so proud of this.
Nothing makes me happier than what I can do for these people.
Okay.
They're jacked up. I'm jacked up. Remember my team? They're jacked up about it too.
All right.
Everybody's having a good time because everybody's happy when this is all done.
Okay.
It's incredible. All right, so here's Kevin. So Kevin comes in with a mouth full of cavities. This guy is in pain, but he's real direct. Kevin is a business owner, he's an entrepreneur, and he has no time to mess around. He needs these teeth immediately. There is no downtime for him. So he's in pain and he wants this thing fast. Kevin also loves to eat too, but it's really more about his public appearance based on what he does for a living. Okay, so Kevin comes to us and you know he needs these fast. We take a look at his 3-dimensional scan. Kevin is an excellent implant candidate. So we have no problem taking him start to finish completely removing all of his teeth on the upper.
Couldn't save those teeth.
No, and the bottom's not salvageable at this point either, but he wanted to transition, and that's totally fine by us. So we're going to transition Kevin. He's already come back and done the lower. We already finished the lower.
Okay.
Today we're going to show you photos of the upper.
All right.
Yeah, so we took him start to finish in approximately 3 hours, actually, and he has no recollection of any of this happening anyway.
Because of sedation.
Yeah, he's asleep for the whole thing. He wakes up on the couch and he's got a new set of teeth.
Okay.
Yeah.
All right.
And his wife comes to everything too, and she says it's completely changed his life. Oh yeah, by the way, this is Kevin now.
Is looking good.
Yeah, he's looking good. You know, he had such a wonderful experience that he, like I said before, he's coming back for the lower. It's where you can really take a patient in pain. I mean, he is not happy with that smile, and immediately give him excellent teeth. Game changer.
Nice.
Minimal pain too.
Now,
almost no pain at all.
Let's talk about the money for a second, because dental insurance doesn't really cover this. Very small portion, even with the best.
That's unfortunate, but it's
Medicare,
true.
Medicaid doesn't cover this at all.
Right.
But you finance it. You say people finance this.
Absolutely. It is our goal to find a way to make this work for you. We will work within your budget. If you want this, we will make this happen.
Now, do you have some sort of a bias where you think they should go to a specialist like a periodontist if you're going to get this done?
Yeah, ideally you would want to go to someone who has a lot of experience with something like this.
Because you work with general dentists in your town.
Absolutely.
Right?
I have phenomenal referrals. My general dentists are the best. I really do believe that. And a lot of them, some of them place their own implants, but that makes no difference to us. When it comes to something like this is a complicated procedure. And if you don't know exactly what you're doing, there's quite a few things that could go wrong. And especially if you can't figure out how to get your way out of something that did go wrong, you're in big trouble. And that's why I do believe that it is in your best interest as a patient to see someone who does this.
Okay, good.
I
interrupted you. You have more photos. What else are we looking at?
You want to talk about some more?
Yes.
Oh, that's great, because I do too.
Okay.
Okay, cool. What an excellent. I love talking about this patient. This is Linda. Linda has been slowly losing teeth with time. Linda has periodontal disease. Now, on the bottom, we were able to control it, but on the top, by the time she got to us, she had already lost a significant number of teeth. So Linda hasn't been in a family photo in a long time because she's so self-conscious about her smile.
They tell you this on the consult.
Oh yeah, absolutely.
Okay.
Linda kind of opened up to us about a lot of this stuff. Okay. And one of the saddest things I heard her say was, I used to enjoy so much. I would go to Publix and I would just go around and I would get little samples. I can't go to Publix and get the samples anymore. I just get in and I get out. Yeah, I just get in and out as fast as I can. And she's so embarrassed. She wears a partial denture when she comes to see us. It's falling in and out of her mouth. She can't say a word. Now, she's a great spirit. She's funny. So she tries to make jokes about it to sort of make the situation seem a little bit easier. But I know that it's rough. And
so what do you do for her?
So Linda comes in. We have a consult. She tells us what's going on. We do a 3D x-ray, find out absolutely Linda has the required structure for what we want to do. So in one day, start to finish, Linda comes in with a couple of teeth and no confidence to leaving with a beautiful smile. So she comes back to us 2 weeks later.
Okay.
I mean, you can see the difference. Actually, look at this photo of her. This is her after the procedure. That's 10 days afterwards. Obviously, we didn't want to take a photograph directly after surgery. We want you to go home and be comfortable. But at your post-op, at your 2-week post-op, we love to see that smile. And she couldn't be happier. In fact, actually, we recorded a video of her biting into her sandwich for the first time too. I know it's on an iPhone and it's not like incredible quality.
Yeah.
It is so cool watching her.
So denture wearers can't really pull things out of their mouth, like bite into a sandwich and pull it.
I mean, there may be a few out there that can, but no, I would say the vast majority could not eat through an apple, a sandwich. Okay. They can't eat any of that stuff.
So I interrupted you. So she bit a sandwich and told you about it? Or made a video about it?
We videotaped it, yeah. I made her bring the first sandwich she was ever going to eat from Publix, her favorite sandwich, into the office so that we could all watch her eat it. It was awesome.
Do they ever get emotional? Like when it's all done, they look at the mirror?
Yes. Now, Linda's strong, and remember, when she's in an uncomfortable situation, she makes jokes and she laughs.
Okay.
So she didn't cry, but she definitely laughed, and you could see the expression of joy on her face and the sounds she was making as she was mowing down on that brand, that sub that she had bought from Publix. Yeah, it was pretty cool.
So really, they're not limited to what they could eat. I mean, could you bite a carrot though with your front teeth?
You can eat anything you want.
Okay.
Randy, that's the cool part about this full arch stuff that we do. You come from a situation where you're scared to eat anything because your bridge might fall out. You might literally knock a tooth out. Some of these patients are that bad.
Wow.
But when you're done, you can confidently gnaw that last little piece of chicken off of that chicken wing, or ribs off that last piece of meat off your ribs. Whatever you want to eat, you can do it.
Okay. Now, there's philosophies out there in dentistry. Some people are doing a lot of snap-in, snap-out teeth, supported by dental implants. In the green room, you say you don't like those.
Okay.
Because patients don't like them.
Well, yeah, I think that if I were to give you a day in the life, so let's say you're a patient, you come to me and you want to know what your options are. And you're leaning towards something that clips in and out, or maybe something that doesn't clip in and out at all, just traditional dentures. If you were to spend just 5 minutes in one of these brand new full arch cases
that don't come out,
teeth in a day. I don't know if I can say teeth in a day.
Yeah, you can.
Yeah. So if I were to give you 5 minutes in that, there's no way you'd ever go back. No chance. Because even though you have dentures that clip in and out, and sometimes that's the right thing to do for patients, because there are some patients where the anatomy requires something that's removable. But if you went the implant teeth that don't come in and out, you would probably never go back.
So what do they like more? The way it looks, or the fact that they can eat and chew whatever they want?
Well, sometimes you'll get the patients that are really just interested in improving the way their teeth function. So in those situations, we'll have guys, it's usually guys, and they come in and they have teeth that don't fit together well, they're wearing dentures or something along those lines, they're in pain, and they want to transition to something where they can confidently eat whatever they want. They love food. I have one specific case, one wonderful patient.
Okay.
So he's this Italian guy, short guy, and he's been through some serious stuff in his life. Unfortunately, he's been in a car accident where part of his left leg wasn't functioning well, and he is not a happy camper when he comes to see me. And he's got most of his teeth missing. In fact, he's chewing on just his front teeth. That's really hard to do. You feel like you're almost like a rabbit just trying to use your front teeth. It's just not an effective way to chew. And this kid, this guy loves food. That's what he does. He cooks. He had a small cooking business before all this stuff happened to him.
Okay.
And he's Italian, so he loves his family. So, he's got a lot of friends and family coming around him to help him out with stuff. And when we got in this situation where we were able to successfully take him from having just a few front teeth to full set of teeth that don't come in and out, he wanted to so he waited before he had his first meal because he wanted to bring his whole family in so that everything could happen together.
Really?
And so he cooked this whole elaborate meal. Yeah, I'm telling you, this is
and ate this in your office?
Nope, not in my office.
Okay.
He did this.
I misunderstood
that would have been
part.
great.
Okay.
No, this was at his. So he's telling me this story at his post-op.
I got it. Okay.
And he's saying, I brought my whole family over. I cooked this wonderful Italian meal because I wanted my family to see what it was like when I bit, because I had been waiting to eat corn on the cob.
Okay.
That's what he told me. He's like, I love just a nice slathered butter, a little bit of salt, corn on the cob. And he brings his whole family in and everyone sits around and they say grace, and he's so thankful for this set of teeth, and he wants everyone to see him bite into the corn on the cob for the first time. And you can just picture this Italian family all around this long table. There's 12, 15 of them all there. And he just, and it's this juicy corn on the cob, and it explodes and hits his cousin in the eye.
Okay.
So he can bite through anything, and he's just and everyone is cracking up. His cousin's got corn in his eye, and everybody is so happy because he finally can get back to what he loves: cooking, eating, and enjoying his life with his family.
You say you see personality differences, like they come in one way, then they get their new set of teeth, and they're not even like the same people.
Let me tell you what else happened to this guy.
Okay.
So not only did it completely change his personality, but he's single before. I can't remember if he might have been divorced. He's already married, and he's on his way to having his first kid.
Good. Because of the self-confidence it gives you.
Absolutely. When you go from having just front teeth, you're in pain, you don't like your appearance, to being able to chew. And remember we were talking about guys and the whole function thing. A lot of times what they find the most compliments, what they find best about moving from minimal teeth or no teeth at all to full fixed teeth that don't come in and out is, okay, yeah, great, they can function, but they also get all these compliments on their appearance.
Okay.
Right? And that's not something that they were interested in their initial appointment. They were interested in improving their function, but in reality, they got both function and appearance. And in this poor guy's, in this, not poor anymore, now he's having a great time. In this guy's life, he went from divorced, shattered femur, unhappy, to completely changing his life. He's married, he has a kid, he's got a wonderful cooking business.
So his confidence is back.
Absolutely. His confidence is more than back.
So no more dentures.
No more dentures for
You
him.
think you can wipe them out in Florida? No more dentures in Florida?
I would love to wipe out dentures in Florida.
Now, you're a dentist, so you probably think, you're a periodontist, you probably think that smiling is the most important thing, or a smile is the most important.
I think it's incredibly important. Well, what do they tell you? What are the two first things anybody ever looks at? Your eyes and your teeth.
You're a periodontist.
Yeah.
You probably think the teeth are like the most important thing.
Well, actually, it's two things. So whenever I'm sure this has come up, so you guys have heard about this, where people describe, well, what's the first thing you notice about somebody when you first meet somebody? It's their eyes and their teeth. And obviously I'm a dentist, so that's great for me because for me it's teeth, obviously. That's the first thing I look at. But it really says a lot about our society because a lot of times these patients, they're kind of judged for not having perfect teeth.
Is this one of those things where when it's all done, they say, I should have done this years ago?
Oh my gosh, yeah, it's really funny that you say that. Because a lot of these patients have been dealing with this for so long, and it is so unnecessary. In fact, actually, sometimes it's worse off. The longer you wait, you might wind up with not enough bone to do what we want to do. But most of the time, we can rebuild that.
Okay. But isn't it true, if you've been wearing a denture like 10 years, 20 years, you can't do this?
That is entirely not true.
Okay.
No. And you know what? A lot of times these patients are, maybe they're going on previous notions or previous explanations to them by their other dentists saying,
like not enough bone.
Like not enough bone. Randy, that is almost never the case. We can always rebuild bone. In fact, actually, if it wasn't for complicated cases, I probably wouldn't be able to do a lot of the things that we do.
Okay.
But we can build bone just about anywhere, predictably. And this is something that we can do to set patients up that's been told that they can, oh, you've been in a denture this long, you have to go down this route because you don't have enough bone. That's absolutely not true.
Now, almost all of these patients are lightly sedated. Is that correct?
Lightly or heavily, it's entirely up to them.
Like oral sedation, IV sedation?
Both, actually. It's entirely up to you. Although in most of these cases where we're going to do your teeth in a day, you come in, we take out your teeth, or if you didn't have teeth, we give you, we remove your denture, and then we place your permanent teeth where you walk out with teeth that don't come in and out. Most of these patients are sedated.
And they have very little memory of the whole thing?
Well, that's a beautiful thing. Half the time they don't even remember the car ride home. They just wake up at home, boom, new set of teeth.
We're short on time. So
do I have time for a couple more?
Two more.
Okay, two more.
I don't want to rush it.
All right, so this case, this is Alan. He came in with,
wow.
He's in pain. He doesn't like the appearance of his teeth. And he's changing his life because he's become physically fit. He walks the stairs at the lighthouse every single day in St. Augustine. He's changing everything else. He's got to change his smile with it. He wants the complete package. So does his wife, right? So Alan comes to me and he says, what can you do for me? I got teeth. Some of them hurt. I don't like the way they look. Can you change me? Absolutely, Alan. We can give you a beautiful set of teeth in just 3 hours.
Okay.
So Alan wanted to do the top first again. I've got a lot of patients that like to transition their way through.
So he would have been wearing a denture.
That was his only option.
Okay.
It was either denture or come see us and see if you have implant capabilities.
Okay.
Or come see us and get implant supported teeth. Right?
Okay.
Yeah, and he came to us, and we gave him teeth in a day. And
Let's take
Alan,
a look.
Yeah, this is Alan. Okay, Alan is very excited about these teeth.
Okay.
Okay, so he's so excited. Just like Kevin, he came back and he did his lower. So Alan now, completely different story. His teeth match his fitness level. He thinks that he's healthier because of what he can eat. Because before,
makes sense.
Yeah, his chewing was ineffective. Now Alan eats more salads than he did before because it's easier to chew, right? Okay, do you want to talk about another one?
Yeah.
Okay, this patient is near and dear to our practice as well. This is Melissa.
Okay.
So Melissa, you can see right now, She is not happy with her smile, has zero confidence, and she doesn't like the job that she's currently working, and she's in pain too. Don't forget that she's in pain. These teeth she's got cavities and periodontal disease. Her gums and her teeth smell bad. She needs a change. So she comes to us because, remember, just like everybody else, she has no other option.
Just a denture.
Dentures or implants. Comes to us, hey Melissa, guess what? No brainer. This is easy. Let's take you start to finish from that to this.
Very nice.
So she's put stuff on our Facebook page about how incredibly life-changing this is. Can't tell you how gratifying. It's such a wonderful experience to take somebody to that. And now, guess what? She's lost like 30 pounds. She's totally changed the way she eats. She's got a new job. I mean, it's crazy. I can't guarantee that you're going to get a new job when...
But it's like anything else in life. If something about yourself, you hate something about yourself, it's going to hold you back.
Absolutely. So when you can change that, your whole life changes.
Now look, I have time for one more photo.
Come on, one more?
One more.
All right, so here's another one. Options, denture or...
New teeth.
New teeth, right. So obviously she came to see us, new teeth. Her background though, hers is kind of interesting. Extract teeth here and there. She winds up with 2 uneven bridges. One's always falling out. If one falls out, then she chews on the other side, and then that one becomes weak, and that one falls out. She's just absolutely sick of having to worry constantly about bridges falling out. So she came to us. Guess what, Terry? You're an excellent implant candidate. And we took her in 3.5 hours, start to finish, from bridges that come in and out to a new confident smile. And this is how she is now.
Nice. Looks good.
Yeah, looks
like
really
you say,
good.
the smile makes you more attractive too.
Yes. And she's an attractive
Changes your
woman.
appearance.
And I think that not necessarily her bridges were unattractive. Obviously, her teeth look much better now.
Yeah.
Yeah. But it was the transition from an uncomfortable situation where you could be out in public and half of your face would fall off. And now that's not the case. She has 100% confidence. She can eat whatever she wants.
And the maintenance, and we're out of time, but the maintenance, you just come in like every 6 months, get them clean, things like that?
Yep, you're back in the system. Just do the same thing that you were doing before. We're just gonna make sure that we maintain your implants, make sure everything's healthy. You brush and floss like you normally would.
We're out of time. Final message, somebody watching this, they're in the 2 categories. They have really bad teeth, they're headed for dentures, they don't want dentures, or the denture wear. But and maybe they've heard what you had to say, but for whatever reason, they're gonna put it off, or they're afraid, or they're worried about the money, or whatever. What do you say to them?
Just come in and see us.
Okay.
Right? Just come in and get a chance to talk to my team and see if this is truly an option for you, because this is going to change your life.
Is that right?
Absolutely. When you go from the situation that you're in to one where you have 100% confidence, it's a game changer.
Is this like the 3rd set of teeth? You got baby teeth, adult teeth, then you lose those. This is like the 3rd set of teeth.
We got some shark genetics in there. I don't know, perhaps. But yeah, this is like a 3rd set of teeth.
So no more dentures, as far as you're concerned.
Well, we are in the business of eliminating dentures.
Okay, good. I want to thank you for coming to the show. Great stuff.
Randy, thank you so much for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.